Hey, good afternoon, everybody. See, some folks are connecting to audio still. Once you get connected, go ahead and introduce yourself. You can say you're here or anybody want to start? I see Amanda.
Hi, I'm Amanda. I'm at work. I might be muting my mic. This is my second Zoom meeting ever, so I hope I don't mess it up.
I think you'll do just fine. You can mute or you can unmute as long as you can, do you want to show video or?
Well, that's a great question. I'd love to. I'm not sure. Oh, wait.
I'll ask you to do that.
Okay.
You don't have to say yes. Everybody that's here, you don't have to say yes, but it makes it a little less weird for me to be the only face here.
Right.
Okay,
it should be connecting.
Great. And then we have Anna. Anna, can you hear me? And then just if anybody's not comfortable speaking up, we do have a chat room available as well. So you can go to the chat, you can type a message, you can ask a question, you can say I'm here, whatever the case may be. You can always use the chat function as well. Keep in mind that the chat will go to everyone unless you click on that and toggle it just to me if you do have a specific intimate more question that you want to have addressed. And that way not everybody will see it. I see a sparrow here, still working on connecting to audio. And
there, I'm. Can you hear me?
I can hear somebody.
Oh, this is Ann.
Hey,
Ann H. Hi.
Hi there. Did you want to start your video with us today? No pressure. I'm looking at a bunch of gray boxes, so sometimes it's nice to see a face, but no one has to do that. And Amanda, I think your camera's blocked. So if you did want to be on it, that's fine, but I just have blackness on your screen here.
Okay, yeah, I see that. I'm trying to get my camera started. I'm at work, so I might have to kind of pop out. I'll try and keep it muted mostly.
And then iPad 2. There's Anne. iPad 2, do you have another name to go by, or? You can always send me a text too. All right.
No, can you hear me now?
Yeah.
Oh, I see. Okay, I'm sorry, I haven't done a Zoom meeting before, so I'm temporarily unmuted, and I just have to remember to do that when I want to talk.
That's fine, and you can stay unmuted. I think we can all play nicely together on unmute, and that way I don't feel like I'm just speaking to a bunch of quietness. I really like these to be super open, free-flowing. Of course, I always prepare some content. We prepared the topic, but how they usually go is people have specific questions. They came here for a reason, and they want to get them answered. So I also want to make time and space for that as well. So like I mentioned, I really like it to be kind of a free-flowing process here. So it is 1:04, so we'll get started as people kind of trickle in. That's great. Welcome. Randy, driving and Zooming at the same time. I got Ann, I've got Amanda. All right. We've got Jim here with us. So we'll get started. My name is Karin Duncan. I'm a naturopathic medical doctor here at Coeur d'Alene Healing Arts in Coeur d'Alene, Idaho. I specialize in integrative neurology, but serve as a primary care physician here. So I see everything from top to bottom and all age ranges. I always say my favorite are cantankerous old men because they make me laugh. But I love all my patients and love what I do. Today we're talking about the constipated brain. I brought this up when the gals asked me, they said, hey, what do you want your next lecture to be on? And I just had a conversation with a patient with Parkinson's that reminded me of my mentor has 2 teenage kids, and when they were young, she was telling them about how she was practicing a speech about Parkinson's and how it manifests and what the pathophysiology was. And one of her children, when they were young, said, so basically those people's brains are constipated. And my mentor, Lori, was like, you're a genius. Like, that's exactly what we're trying to tell people, is that your brain can be constipated just like the rest of your system, and really connecting, the gut brain axis. in a way that was so simple and kind of groundbreaking for all of us. So my thanks and gratitude go out to a former, 6 or 7 year old Michelin kid that came up with the constipated brain. But really what we're talking about today is your poop and how your poop affects your neurologic health and what that connection means, and how we can either prevent it or fix it or recognize it if it's there. Again, I always, like I said, have some content prepared, but I like to open it up right away. We only have about 30, 40 minutes together to questions.
Hi, my name's Sparrow.
Hi, Sparrow.
How's it going?
Good. How are you? Welcome.
Thanks. So I'm so happy I caught you on my lunch break. I think what I'm noticing is as I'm getting older, I'm almost 40, and I just have more things happening with my nerves happening, and I can definitely connect it to my gut. And I can't always tell that I'm where I have tons of food allergies, and I'm just wondering if they're connected, and then also what if there's another connection beyond what I'm even seeing. So that's why I'm here.
Yeah, well, I really appreciate you being here. And, and I guess I should have said starting off, obviously, right? Like I can't get medical advice on a Zoom, but what I can say is just based on that little snippet, I can feel fairly confident that, like you said, your gut is affecting your neurologic health. A lot of people don't know we actually have 4 neurological systems, not 3. We have our central nervous system, which is our brain and spinal cord, the peripheral nervous system, which is, feelings of heat and sensation and vibration and different things like that. We have our autonomic nervous system, which releases the fight or flight chemicals, or the rest and digest, and also regulates your heart rate and your breath in those moments. And then we have our enteric nervous system, which is the trillions of cells and neurons around our gut by itself. That enteric nervous system can work autonomously, even if the vagus nerve, which is the nerve from your brain down to your gut, is severed in a vagotomy. Our enteric nervous system continues to work. So I thought that was really fascinating to me, that it has its own autonomy, infallibility, whatever you want to call it, that it continues to do what it does down there. When there's inflammation in the gut based on whatever insult is there, whether it's an allergic one or an immune system response or infection, injury, whatever the case may be, it definitely affects in a systemic way. We have, more bacterial cells in our gut than we do in our entire human body, right? Tenfold at a 10-to-1 ratio. So if you are prone to being allergic, then what I would kind of say is that your immune bucket or your inflammation bucket is pretty full most of the time if you have allergies, right? That's an external manifestation of internal inflammation. And so stabilizing that would probably be one of my first courses of action to stop those downstream effects from happening, right? I always talk about killing the closest alligator to the canoe. If you're a patient of mine, you've heard it a million times, is that while nerve health may be the biggest alligator in your health picture, the one that's going to eat you first is going to be stopping that immediate inflammatory response, that immune response that's leading to allergies. So when we trigger those inflammatory cytokines and that cascade, it will have a ton of downstream effects throughout the entire body and system. And where yours are manifesting or where yours were already vulnerable or susceptible would be in your nerves. So to kind of answer that question, do I think they're connected? Yes. And then I think recognizing is a really great, first step, is saying, hey, when I eat something weird, my symptoms flare. And then starting the process to healing your gut to slow down that sequential consequence. Does that answer your question, Sparrow? Or
Yeah. I mean, I want more information. I want it all. Yeah. I mean, it's just so weird. It's just a weird journey I've just been on, and so just constantly trying to figure it all out. And I mean, I eat better than most people because I can't eat a lot of things, and yet I still have symptoms. So I'm just, trying to figure out what is that stabilization there for me. And yeah. So yeah, I'm here. I'm listening. Thank you.
Great. No, and I think for you, I mean, if you're eating really that well and it's so restrictive because you're having these symptoms, you know, if you were my patient, you were sitting in front of me, I would say that restrictive of eating isn't healthy and normal, right? And we'd want to investigate, is there an autoimmune condition underneath that? You know, that mast cell hyperactivation can come from a B12 deficiency. So there's a lot of nutrients that I would look into for you in your physiology and biochemistry to make sure that, you know, do I think allergies is the root cause of your gut dysfunction? No, right? What's the root cause of allergies and why are we already on that phrase, and why are all these foods really affecting you systemically when really mouth to anus is supposed to be a closed system, right? We're supposed to absorb what we want, but the rest of it's supposed to go through. So when you're saying so many things are affecting me systemically, then I think, you know, there's a breach in security. Nonetheless.
Yeah, I'm a methylator, they call me, so I have to have a certain kind of B vitamins, and that was a huge deal to figure that out. So
right. And a lot of times people will say, you know, you are what you eat, or even the vitamins that you take, if they come delivered in a certain packaging, then they're going to make a difference. I don't stop at that part though, right? I'm a neurology geek. So we are what we eat, but then we are what we absorb, but then we also have to metabolize. And then we also have to deliver. Do we have the delivery system? And then we have to receive. So, you know, when we talk about neurology, and so many of my patients have brain health issues, like the brain is sequestered for a reason. It's protected up there, but that also makes it really difficult to receive the nutrients that we take in. And if those previous parts are compromised, then we're delivering even less to the brain. And so, you know, you are what you eat is such a misnomer because there's so many steps down the road to actually get those nutrients to where they need to go. And if there's autoimmune and you're taking methylated B12, but then we've got something attacking it in the absorption phase, it's not doing a whole lot for you, right? Like there's still more steps to investigate of whether or not you are getting the rest of that nutrient intake rather than just what you're putting in your body. So
yeah, I'm at kind of a standstill with Western medicine. So I've taken all the blood work and everybody's like, you're fine. I'm like, no, I'm not fine.
Well, I would find somebody who will advocate with and for you. So it can be really exhausting, and we'll kind of, you know, move on here and share the wealth. But what I will say is you bring up a great point, and it's a passion of mine. So I can't help but step aside and say patient advocacy is something that I'm such a supporter of, but it's really challenging when you don't know which questions to ask and you continue to advocate in a way that's like, I don't even know what to ask, but it doesn't feel right. And it actually causes a lot of stress and anxiety and other health conditions in that. So I can't stress enough finding a provider that's going to hear what you're saying is, I don't feel right. You do the work. This is what I'm paying for you for. This is what I need you to do, is get creative and find some reasons that this could be happening, because I do think there's providers out there. I'm obviously biased to the three of us here at Coeur d'Alene Healing Arts, but I've run into some really great conventional Western docs too that are willing to do deeper digging and working into some things. So continue to advocate. I know it's exhausting.
Thank you.
As a priority.
Thanks so much.
Of course.
And I'm trying to remember to unmute when I want to talk, but just to echo what Sparrow said, I have allergy problems too. It just comes out mostly in respiratory stuff. So that was interesting to hear. So I didn't used to have any, and now it's dogs. I used to have a dog. It didn't bother me. Now I just sneeze and drain, and different foods and fragrances. So nothing that really holds me back, like Sparrow possibly, but
no.
But
it's aggravating. It's affecting your quality of life. And again, when we look at that, you know, that inflammation bucket, I love using that analogy because I think people can then say, oh, I'm maybe like 3/4 full. And then you can start to visualize, like, what does my inflammation bucket look like? And if every drop tips it over, right, then you're at this place where we need to lower that threshold. We need to be more resilient to the environmental toxins. And I didn't go into environmental medicine for the exact reason that it scared the crap out of me, because everything is a toxin, everything is harmful. So rather, what I focus my time and attention on is, how are we detoxifying? How are we getting those eliminatory functions in our bodies to be optimal so that we can withstand the toxins that the world gives to us and we're able to detoxify it? And then when we run into these obstacles where our inflammation in our immune system is yelling at us saying, hey, we can't handle anymore, we are at our limit, Now we need to start making adjustments to what we're interacting with to give it space to heal, and then maybe reintroducing at that point in time. But I think that's kind of where we run into difference in philosophies with conventional medicine versus naturopathic medicine, is that instead of suppressing the whole thing and saying, avoid everything altogether or take this medication, it's more like, let's really identify what's tipping your bucket over and why it's so full and why it won't drain, and give it pause, give your body time to heal, because we know that it can, and then start reintroducing those things in a very strategic way. Anybody else have questions, concerns, comments, thoughts before we kind of keep on going? And we've had a couple more people join us here, so welcome to Leah and Randy and Ashley and Anita. I'm just a reintroduction. I'm Dr. Karin. I'm here talking about the constipated brain. We're about 15 minutes in. We've talked about a couple just little case studies, I'll say. We also have a chat box here. If you don't want to show your face or you don't want to talk in front of everybody, you're more than welcome to send me a chat either privately or with everybody else. And that can keep the conversation going. I really appreciate contributions, participation. We're here as a public service, offering this as a community service to answer your questions. I mentioned at the beginning, we have topics coming into this because nobody just wants to sit here and stare at each other over Zoom, especially after a year and a half of doing it through the pandemic. But most it's fun when people participate and ask questions. So I'll give it about 30 more seconds and see if anybody has anything to add or ask, and then I'll kind of go into some reasons to poop.
And I'm also interested in the brain because my mom had Alzheimer's, and just when it said the constipated brain, so that reeled me in right there. So
great.
Just so you'll talk about probably the connection between the two.
I will. Yep.
Okay.
Absolutely. Well, let me dive in a little bit. So why do we want to poop? Does anybody have any thoughts on that?
Stuff in, stuff out.
Stuff in, stuff out. Yep.
Get rid of toxins, get rid of waste.
Yep, get rid of waste and toxins. Any other thoughts, comments? It feels good, right? If we have good, healthy poops, feel lighter, you do a little jig out of the bathroom. Woohoo! Get ready to take on the day. Well, what's that?
My mental state, there's whenever I can have a good poop, because I don't poop well and often, I definitely can feel an immediate lift in my mental and emotional state. So
great. And who is that talking?
Anita.
Hi, Anita.
Hi.
Yeah, absolutely. I think that's a really good point. Anybody else have that feeling of, lighter, both physically, mentally, emotionally, like throw it at me. I can take it.
Yeah, it does feel good.
Yeah, I literally got rid of the shit. Let's take it on. Let's get moving. Here's some reasons to poop, right? We can eliminate heavy metals. Our exposure to heavy metals is pretty much inevitable. Like I said, we have the ability to heal. I tell all my new patients this. We have the ability to heal as humans. It's phenomenal given the proper environment. And then I have to drop the bomb of disclaimers like, we don't live on a planet that offers the proper environment for healing. So we've run into this clash of, naturopathic philosophy, which I embrace and I love, and I want to use it as best as I can, with the knowledge, kind of like I alluded to before, that we need help. And what a lesson in so many ways, right? Energetically, spiritually, like we all need help. We can't do it ourselves. We're not meant to do this by ourselves, this healing process. But our planet at this point in time isn't offering the environment to properly heal our bodies. So while it would be wonderful to say, hey, we can heal ourselves with no extra effort or support needed, it's not necessarily realistic right now. So we are exposed to heavy metals. Anybody over the age of 50 is exposed to a whole lot of heavy metals, most likely, because that's really when we started becoming aware that it was in our paint, it was in our atmosphere, it was in our environment, it was in our water, all these different things. So our feces binds heavy metals like mercury, lead, and cadmium, and then when we get it out, we get them out. It binds hormones. Estrogens, both in men and women, are bind to something called glucuronide molecules, and those bind estrogens and they get them out to save us from estrogen dominant diseases. mood disorders, different hormonal imbalances. And when we have dysbiosis in the gut, we actually break those bonds and we send estrogen back into the bloodstream, right? So now we have all of these estrogen dominant things, we have imbalance, and we have this nonstop circulation of excess hormones that we can't actually get rid of. Not to mention the undue stress it puts on the liver, right? It's already detoxified this stuff once. It already filtered it out for you and put it in the bloodstream and got it to the point where, hey, this needs to be bound and gotten rid of, and now we're reintroducing it through hepatic circulation saying, you got to do it again. We didn't get rid of it. Sorry, my bad. Sorry. And now your liver is like, I'm doing this and I'm doing primary detoxification of other things that we're constantly being introduced to. You can just imagine that downstream effect of how that affects our detox organs. Somebody's got some background stuff going on here. I'm just going to mute everybody. But you can unmute yourself if you have something to say. I'll just randomly click mute all if we hear some background noises. Mycotoxins. Tons of theories out there now about the toxins released from mold that we're exposed to getting processed through the body. And our poop is, again, our feces, something that binds to that and gets rid of it in elimination. Dioxins, those are human carcinogens, and those also can cause atherosclerosis, hypertension, and diabetes. When we have long-term exposure to those, it can cause disruption of so many different systems in our body, including our nervous system, our immune system, reproductive system, and our endocrine system. Increased levels of these dioxins also impair our liver function. So now, again, we've got another detox organ that's being affected by this exposure. And a quick aside here, when I talk about detox organs or routes of elimination, you know, we have 5 organs of elimination, and that's our lungs, our liver, our skin, our urinary system, and our colon, right? Our GI tract. So those are the 5 organs of elimination. I always talk about that with my patients. And then I also say, I think there's 2 more ways that we detoxify our body, and that's through emotional catharsis, healthy processing of our emotions, and then sexual intimacy. I think that connection and intimacy with a partner is also another way that we release toxins and can detoxify our system. So when we have 5 and one of them is compromised, and then that compromise of one then compromises another one, now we're really starting to see the effect of how all these things work in concert and synergistically with each other. We can't just take one out of the equation and expect everything else to pick up the slack, because they have their job to do. And anybody who works knows that, right? If one of your coworkers says, I'm not going to work today, you do my work. It's not just that one day that's affected. Now you put off your work for the following day, and it's this downstream consequential effect. And we're not taking away the insult. We don't get a weekend to make up for it. We're existing and living on this planet, so we don't have a break from exposure necessarily. Pooping also gets rid of pathogenic bacteria. We're going to talk a lot about the microbiome and the ratios of bacteria and good ones and bad ones and what it needs. But we have this really innate ability in our immune system through our mucosal barriers in our intestinal cells to get rid of and kill pathogenic bacteria. There is a die-off symptom though. When we kill bacteria, they release their toxins, one of them being LPS. When they do that, that causes disruption in our system. And when we are going to the bathroom and eliminating regularly, we can get rid of it in a way that that die-off reaction then doesn't cause an effect in the rest of our systems. Again, we kind of talked about environmental toxins, xenobiotics, metabolites of drugs and medications that we take. Again, those are filtered through our feces. So those are just some of the reasons that we need to get rid. That's why we poop. That's why we should love to poop, right? That's a good start. Does anybody have any questions or comments or concerns over that, why we poop? Or how good it is to poop? Okay, so now let's talk a little bit about the constipated brain. and how that constipation, if somebody is constipated, what that means for our neurologic health. So this will be focused a little more toward neurologic health, but again, disclaimer is this is affecting us systemically. That brain is protected, so by the time it's affected, and this is what I tell so many of my patients, by the time your brain is affected and showing symptoms, chances are many of your systems in your body have been affected. I have so many people with Parkinson's with elevated kidney dysfunction, liver dysfunction, other organ, malfunction or dysfunction, or things going on in different systems of the body, because by the time it gets to your brain and gets through the blood-brain barrier and causes disease, it has to go through a lot of different stop gaps or bouncers, if you will, right? It's got to get through all the levels of disease. So when we're constipated, when we're not flushing out all of these things that I just talked about, right? We're causing imbalances. We're causing elevated toxin level in our blood. We can actually cause elevated adipose tissue to create, because that's what we do when we need to store and hoard things. Hey, we have toxins we're not getting rid of. Let's store them in our fat cells. Let's store them in our bones. Right? This is what we do as human body, where we're resourceful. We're amazing, the human body, but sometimes at our own detriment. It's like, oh, we got too much of this. Let's just pack it away over here and our bones can take care of it. So there's a lot of different, like I said, downstream detrimental effects to having these toxemias being recirculated in the blood. We have a nerve that comes directly from the brain, a cranial nerve that's called the vagus nerve. And it's not the what happens in vagus nerve, it's VAGUS, vagus nerve, and it is responsible for the function of our autonomic nervous system. Again, to recap, that's the one that regulates our heartbeat and our lungs. That's what creates the pupillary response when we're under distress and we dilate because we're looking for danger. It also is responsible for that fight or flight response when we're in danger. We're giving a lot of different responses, adrenaline and catecholamines when we're in that fight or flight mechanism. So when that vagus nerve is severed, we actually know, like I said, that our enteric nervous system continues to function. What we have seen, though, in the research, especially with Parkinson's disease, is that when we have chronic inflammation in the intestines, they release a protein called alpha-synuclein. And this alpha-synuclein is a naturally occurring protein in the body, and it travels up the vagus nerve from the intestinal cells to the brain. And then what we're seeing in autopsies of people with Parkinson's is these aggregates of alpha-synuclein in the substantia nigra, or the movement area of the brain. So the theory is, of course, this is what's causing the pathophysiology or the disease process of Parkinson's, but the initial inciting factor is this intestinal inflammation that it is releasing in a way to protect it from the insults that are happening in our intestines. So welcome, Lori. We have a new guest here. And we're just about 30 minutes into it. So just for the new guest here that has joined us, I'm Dr. Karin from Coeur d'Alene Healing Arts, and we're talking a little bit about gut health and brain health and how they are connected. So we also know that in the gut, in that enteric nervous system, 90 to 95% of our serotonin is made in the gut. So when we talk about different mood disorders and mental health issues and the use of SSRIs and antidepressants, what I tell a lot of people who come into my office and say, I've been constipated for 10, 20 years and I've been on an SSRI and I don't know why I can't break the cycle. I like to simply say, of course you feel sad. You don't even have serotonin in your brain. You don't even have serotonin in your body to help you with those happy hormones. 50 to 60% of our dopamine is made in our gut. So again, talking about Parkinson's and the deficiency of dopamine, who is one of the number one symptoms, non-motor symptoms of Parkinson's, is constipation. Of course you have a deficiency of dopamine. Half of your source is being compromised by gut dysfunction. So to kind of tying those things in together for people, first of all, can be a relief to say, oh, this isn't me, this isn't on me that I feel sad and depressed, but the actual ability to absorb and digest and metabolize and make these neurotransmitters has been compromised because of my gut health. And then the buy-in for really treating the gut and recognizing that that can be a contributing factor tends to be improved. We need to absorb tryptophan and tyrosine and phenylalanine and dopamine. We need hydrochloric acid in our gut to break those things down and use them effectively in our body. So many people that I run into are actually hypochlorhydric. They don't have enough hydrochloric acid in their gut to even break down and start that digestive process optimally to begin with. So these all play in together to how we survive and thrive in all of our systems, and especially, like I said, mental health and neurologic health. There's a ton of research out there now that supports the gut microbiome and ADHD. We know that the microbiota can produce neuroactive compounds, again, neurotransmitters. We're seeing increased pro-inflammatory cytokines in people with ADHD, like interferon gamma, IL-16, that show like quantitative improvements with the administration of probiotics and gut health treatments. So this connection has been proven over and time again. And I think it's just really important to recognize that connection and to understand that these processes do have a starting point and they do have a root cause. And how do we acknowledge that as well as treating those symptoms and manifestations? So I'm going to pause here for questions, thoughts. And do you have anything to ask? And just, you're the only one I can see, so you look like you got some.
I feel like I should have some questions. I didn't catch the name of what travels up the vagus to the brain, that first thing you were talking about. I think you were talking about the Parkinson's. And
It's alpha-synuclein. And it's alpha, and then synuclein is SYNUCLEIN.
I'm sorry.
Okay.
It's just something I had never heard of before. So, but it does make sense. I never thought about what's produced in your gut getting to the other places in the body where it's needed, and if that travel sequence is disrupted. That makes sense. So yeah, I like this.
Yeah, I mean, it's a highway. A lot of people, they'll say the vagus nerve is a highway from the gut to the brain. It's a direct shot. And there's so much more, research coming out of it. And I know I mentioned at the beginning of this, why it's called the constipated brain, but my mentor and teacher, Lori Mishley, really goes into this and had taught me about this years before. And then my mom sent me, a Neuro Today magazine article or something, like, guess what? Metabolism affects your brain health. And I was like, I know, but it's becoming, the exciting part though, is that it's becoming more widely accepted. It's becoming more addressed. I have referrals from conventional neurologists all the time that have put their people with Parkinson's on probiotics. They're like, I'm not really sure what else to do. You take it from here, but I put them on a probiotic. I know that this much is true. So I feel really excited about that bridge between the two, philosophies of medication and of medicine, and talking about diet and talking about different things like that. I know Anita just asked, or sorry, it's a private message, so I'm going to pause. So the other thing I want to talk about is memory. Memory is a broad umbrella, right? We have a lot of different neurodegenerative diseases, and they all kind of can come together, and we look at it as a big Venn diagram. They each have their own hallmark symptoms and signs and different ways that they manifest or progress. But they really do overlap in a lot of different ways. And it's Alzheimer's and Parkinson's, different Lewy body dementia, and different kinds of dementia kind of all can overlap and interlay there. And really all neurodegenerative diseases can have similar signs, symptoms, manifestations, things like that. What we also know is that butyrate, right, short chain fatty acids, those are things that we get when we ferment our fiber, when we eat plants, and then our fiber is fermented, it releases these short chain fatty acids like butyrate in our system. They actually can increase the mucosal barrier and raise BDNF in the system. So BDNF is brain-derived neurotrophic factor. It's how we grow new neurons. It's how we sprout them. So we can talk about neuroplasticity all day. I can tell you to go do things that you don't know how to do in the in the hopes that you'll grow these new neurons and create these new neuronal pathways. But at the end of the day, it's a biochemical process, and we need certain nutrients and cofactors and biochemical ingredients to be able to build those bridges, to build those synapses and those neuronal pathways. And this is one of those, is that when we enhance that brain-derived neurotropic factor by eating plants that are fermented, then we get that fiber, we're more apt to be able to do this. So when we're talking memory and cognition and wanting to be preventive of any decline, that's one of the biggest things that I can talk about broadly is a plant-based diet and getting enough fiber in your system. And just for the record, this webinar is being recorded. It'll be posted later so people have access to it at any point in time, and you can share, or you can ask questions, or you can email me. Even if you're not a patient of mine, you can always shoot me an email and ask me questions directly related to the webinar to clarify anything that we chatted about. I'm going to give it a couple seconds, see if anybody comes up with anything. I've only got a couple faces on here. So really good question here from Sparrow is basically, can you get too much fiber? What if you have too much fiber? That's a great question, right? The foundations of pooping. Does anybody know what one of the foundations of pooping is? What do you need to poop?
You need both. You need food.
You need food. Yep. What else?
Water.
Water.
You need good motility, and I don't have that.
You need good motility. Yep. You need movement. Your body is made to move. So lack of exercise can lead to low motility. You need hydrochloric acid, right? We can get all the food we want, but if we can't break it down, we can't get rid of it. One of the big ones, so we talk about too much fiber. So yes, if there is, let me answer that question first. If you are only getting fiber and we're not doing those other foundational things, it can absolutely have a bulking effect and a detrimental effect. If you're not having motility and you're bulking your stool and you can't get rid of it, then we are causing some issues, and I would say would lead more towards intestinal permeability and then higher inflammation and probably higher reactivity rates, you know, through introducing those antigens or those pathogens from your food product into your bloodstream or into your system because of that intestinal permeability. Because it's, again, when we talk about the bacteria breaking things down, they're still breaking things down. And if it's not moving, then they're releasing their toxins and we're recirculating that through the blood. So we can't just do fiber. So that's a really good point. We have to make sure we have all those other foundational things involved. When we talk about the nervous system, what I really want to hit on though is the ability to poop largely is reflective of our ability to drop into the parasympathetic nervous system tone, right? Our autonomic nervous system, the one that's responsible for our heart rate and our lungs and our ability to react to dangerous situations, puts us either into the sympathetic nervous system, that fight, flight, or freeze nervous system, or our parasympathetic nervous system, the rest, digest, restore. There's two really interesting facts that I talk about with a lot of my patients, and this is that you can't have it both ways. It's one or the other. Either your nervous system is safe and it's resting and digesting and restoring, or it's not. And we are not meant to run from a bear for more than 30 seconds at a time. And I think if each of you kind of sits back and reflects, you're probably running from a bear a lot longer than 30 seconds at a time throughout the day. And that sympathetic nervous system, when we're in it, when we're in fight or flight, basically your internal organs, your viscera is saying, ain't nobody got time to poop. We don't have time to absorb, to digest, to metabolize, to go through this entire process. We're not making hydrochloric acid because we're running from a bear. So stress levels are directly going to correlate to your ability to have motility issues. I mean, there's a whole diagnosis of exclusion based on that in IBS. Now, I don't love that diagnosis. There's a root cause to it. But the pathophysiology of it essentially is that stress is affecting your bowels. And when we talk about what we need to move bowels, to remove feces, to eliminate, that nervous system tone, in my opinion, from what I've seen from most of my patient clientele, is the most important factor. We can give you water and food and fiber and get you exercising, but if you don't ever shift from that sympathetic nervous system into a safe space and actually do your breathing exercises and make sure that you're relaxing and your sphincters can relax, because they physiologically will not if we're in the sympathetic nervous system, then it's going to be much harder to have that intestinal motility and then to actually release bowels. I even had a patient one day that says that my job is so stressful I don't have time to poop. I go sit on the toilet and I push it out as fast as I can and I get done. And it kind of blew my mind. But in essence, we have to make time to poop. And if that's the one time a day that you can be in parasympathetic nervous system, then we need to optimize that for sure. But I think that's one of the things that most people don't actually recognize about their body is it can't be both and. To be in that sympathetic fight and flight mode, it's actually unnatural for your body to pass stool in those times. So I'm pausing here to see if there's any questions or comments on that. So let's move into what do we do about it, right? Everybody wants to know, what do we do about it? You tell me how much, elimination and detoxification is affecting my neurologic health in addition to everything else in my system. What can I do about it? The very first thing that I like to talk about is the cephalic phase of digestion. Digestion doesn't start in the stomach. It doesn't start in your intestines, and it doesn't, neither of those places. It actually starts in your brain. So when we think about food, when we smell our food, when we imagine our food, when we show gratitude for our food, when we eat with other people in a community setting, we actually set our mind to be prepared to receive food. Like I said, it's not just what we eat, it's what we absorb and what we deliver and what we receive. And when we involve the brain phase of digestion, when we actually get our brain ready to recognize our hunger cues and release hunger hormones and start salivating, now we're starting the digestive phase. And in the saliva that we make, we have enzymes that break down carbohydrates. So digestion then goes to our mouth and we start breaking down foods while we're chewing it. So we need to chew to completion. We need to take small bites. We need to chew thoroughly. We were given this whole set of teeth for a reason. So making sure that we're taking the time to chew it completely and allowing that digestion just to happen in your mouth. And then we're swallowing that saliva with the enzymes and the broken down carbohydrates that triggers the stomach to make hydrochloric acid. And that hydrochloric acid is necessary. And there are so many people out there who are on PPIs because they're having heartburn and reflux that probably actually have low hydrochloric acid. And then we're causing so many more detriments in that realm, which I probably don't have time to get into today, but maybe we should make a whole different Zoom call about the dangers of chronic use of proton pump inhibitors. But then that hydrochloric acid in your stomach, we start creating that, and that drops the pH of the stomach, which actually breaks apart an enzyme called pepsinogen, or a proenzyme, into being an active enzyme called pepsin, which breaks down proteins in the stomach. So now we're digesting efficiently. And when that acid drops and it seeps through into your small intestine, those are signals for your pancreas to release amylase and lipase, and your gallbladder to squeeze so it can emulsify fats. Digestion is sequential, and it has to happen in order. When we dump a bunch of food in an empty vessel that's not ready to receive it, we are not going to digest food properly. If it's not digested properly, we're going to have a very hard time absorbing it. We're going to feed opportunistic bacteria. Then we're going to have undigested food in our stool that's challenging to break down, and we're going to be constipated. If we're not doing all those things properly, we're not going to have motility issues, and we're not going to be able to eliminate effectively. Now we're going right back to the beginning where we started. If we're not eliminating effectively, what are we doing to the rest of the body? So the very first thing that I talk to people about is, are you are you in the middle of work like I do so often? I first want to say I'm guilty of. I'm in here charting for patients or preparing for patients and eating my sandwich. And am I even thinking about my food? Do I know where it came from? Am I showing gratitude for it? Am I smelling it first? Am I involving my brain and giving my body a chance to actually receive the nutrients that I'm giving to it? And when we start doing that, rarely are we going to need a supplement to do it for us. Now, some people do. Some people have lost the ability to create hydrochloric acid, or they have an autoimmune disease against their parietal cells, which give us hydrochloric acid in the stomach. So then we can supplement with that and actually help that digestive process. A lot of people with Parkinson's have actually lost their ability to smell, so they're losing that cephalic phase of digestion. So now we supplement with hydrochloric acid to get that process started back up again. Now we go to, what are we putting in our body? Is it easily digestible? If we're in a space where we're having a hard time digesting and we are working through a high inflammation state like allergies or food sensitivities, can we actually only eat pre-digested foods for a while and give our system time to restore and heal so that we can then start breaking it down again? Because when we're asking too much of it in this snowball effect of malabsorption and maldigestion, then we kind of keep going down that spiral. So can we give it a break? Can we take some time off and do some intermittent fasting or some broth fasting or pre-digested foods to really give ourselves a chance to heal and then start the whole process from a clean slate? And I think just in the last few minutes, we've welcomed Matt to the conversation. So welcome, Matt.
Hello.
Hi. So this is about a 45-minute chat, and we're kind of hitting that. I know you jumped on here a little bit late, but it's fine. We're going to have it recorded, so you'll have access to it later. But do you have any questions or anything that you wanted to add to the conversation?
Sure, I could ask a question.
Great.
I'm changing my diet to a pescatarian plant-based diet with juicing. And as I do that, could you talk about the digestive implications of it?
Absolutely. The very first thing that I'll hit on is I love juicing to manage inflammation. I don't love juicing if you have blood sugar dysregulation issues. So as a broad paintbrush there, juicing removes the fiber and can kind of break down things into just those natural sugars. So, you know, everybody's health history is different. So I'll just say that kind of out in general. Pescetarian diet, I think is phenomenal. What I tend to see, again, pretty broad brushstrokes, is when people restrict their diet in any way, shape, or form, it's ensuring that the foods that you are getting are nutritious, have nourishment in them, right? I've had plenty of patients who said, I'm on a vegan diet, Karin, I'm fine. And then when we go through a diet diary, you know, they're eating pretzels and Cheetos, and yeah, those are vegan. Those constitute as vegan, but are they nourishing for your body? So, you know, even in any diet and any label that you have, is ensuring that you have the nutrients in a balance that can support your body and what it needs. Again, anytime we restrict foods, in my practice, I would run a basic nutrient panel on you to make sure that, hey, are you iron deficient already? Are you able to absorb things? What's your hydrochloric acid status? How are you doing with the restrictive diet? And is there anything that I think that you would need to support your health conditions or your health picture as a whole? And if those things have been restricted, then how can we supplement in a way that's responsible for you in your situation? So let's just say, Matt, that you're on a perfectly pescatarian diet and you're getting all the healthy omegas from your fish and you're getting plenty of plant fibers and you're juicing for inflammation. I think what you're doing for your digestive system is still, you know, we still have to start from the top down. You're still having to involve your brain. You're still going through the digestive process as is. But I think what you're, again, is you're affecting your microbiome in a way. You're reducing the inflammation in your gut. If you're eating things that are pre-digested, you're easing the amount of energy it takes to digest those foods. And again, then kind of maybe healing your gut or allowing it to have some pause there to heal itself. And then hopefully with the increase in plant foods in a pescatarian diet, you're getting more fiber and you're able to eliminate more effectively. So I think those are my very first reactions to anybody who says that they're on any kind of naming diet is, what does that look like and what is your health picture overall? Does that answer your question somewhat, or do you have a more specific one to add?
Sure, I might follow up. You mentioned the microbiome. In thinking about probiotics, it seems that most of the probiotics are milk-based, lactose-eating bacteria. And since I'm eliminating dairy, they're not going to have anything to live on. And since I'm eliminating most meats, maybe there are things in my gut that aren't going to live there anymore. How can I think about the sorts of bacteria that grow well on the plant materials?
Yeah, well, I mean, in essence, you kind of answered your own question and that is, do you need a probiotic, right? Probiotics aren't for everybody. I know that there's a lot of people out there say everybody needs to be on a probiotic and this is what we need to do. And I disagree. I disagree vehemently that everybody needs to be on a probiotic. So as far as, you're saying these probiotics are lactose feeding, there are a bunch of different strains of probiotics that are out there that would survive and thrive in your system if it was indicated without a dairy in your diet. But really what I say is focus on fermented foods if you want to replete the microbiome in your system. That's a really great way to do it, and include sauerkraut and pickled veggies and different things like that in your diet to help support your microbiome. And then as you continue to go, and if your elimination is positive and healthy, you are eliminating, we mentioned this a little earlier in the call, those pathogenic bacteria, when they don't get to feed and they die and they give off those die-off toxins, we actually grab those with our stool and we're able to eliminate those. So I think the more you err towards this, diet regularly in a very healthy way and include probiotic foods, I think the necessity for a probiotic goes down significantly if you feel like you need one. And again, I don't think that's an ubiquitous prescription as many people may. That's my own opinion.
Thank you. I recently, maybe in the last 4 months, took an antibiotic, and learning a little bit about the species of bacteria in our bodies and how those species get to be fewer and fewer as the courses of antibiotics happen over the years.
Right.
I just have this fear that maybe I don't have the right bacteria growing in me, but but you're saying that actually there are lots of ways that those are replenished.
Absolutely. Yeah, I think, our body is pretty miraculous in that way. And if you're having symptoms from, dysbiosis, gas, bloating, belching, constipation, diarrhea, maldigestion, undigested food in your system, nausea, vomiting, we can kind of go through that. Then that would be a reason to investigate the need for a probiotic. We have the ability to run stool tests, and you can actually see exactly what bacteria is in your stool. And that way we can we can focus your replenishment in a very strategic way to enhance the processes there. But again, I practice individualized medicine. So first of all, to say everybody needs a probiotic is actually a misnomer. I've taken many, many, many patients off their probiotic and they feel much better because sometimes if we're adding bugs to an already dysbiotic situation, it doesn't necessarily mean that they're going to do the right thing. So I think looking a little bit more into if you have that concern or fear after being on antibiotics, then that, a simple stool test could either make those feel better or give you a strategy and kind of that yellow brick road on how to treat moving forward.
Thank you.
Absolutely. Any other questions before we sign off here? So a couple more points that I just want to, suss out here before we hang up is that if you are constipated, if you're experiencing brain fog, if you're experiencing neurologic dysfunction and other GI dysfunction, there are a couple things, really I want to look into, and we kind of talked about it, running some labs. You can look at your GI map, as you call it, and see what the bacteria is in your gut. Look at your thyroid function. Thyroid dysfunction can lead to constipation, can lead to brain fog, can lead to some of these other neurologic conditions. A dysfunctional thyroid can overlap in a lot of ways symptomatically as some of these neurodegenerative diseases, including simple dementia or mild cognitive impairment. And then nutrient deficiency. right, can also lead to a lot of these different symptoms and manifestations in your neurologic health. The last thing really that I want to focus on is medication side effect, right? So medications can cause constipation. Medications can cause some neurological conditions and symptoms. So finding somebody that's willing to really look at your whole health picture in full and say, you know, here's what you're putting into your body and here's what you're getting out of your body and here's all the physiology in between, and be able to kind of to map that out and support it in a way that's very strategic. I say this a lot, is that I'd rather use a sniper rifle than a shotgun for health, because I want to know what is going on and how can we fix it and what's our therapeutic approach, even if we have to change it in 3 months because we didn't get the desired effect. What I don't think is useful for our detoxification pathways or for our pocketbooks is giving you 17 different supplements and saying, one of these should work, stay on these forever, right? So I really say there's a lot of practitioners out there that are willing to do the work for you. Find an individually, based one that wants to treat your health history and your health conditions and do what's right for you, because I don't at this point in time, I haven't seen yet a prescription that fits all. So continue to advocate for yourself. Sparrow, keep working. It sounds like you've hit a few roadblocks there, but I think you keep advocating, you keep asking questions, and you know your body the best. And everybody take a deep breath, because when we exhale, our nervous system is hijacked into parasympathetic nervous system. Believe it or not, we can hijack the system just by exhaling. So find time in your day to exhale and poop. And if you have any questions, comments, concerns, you know where to find me.
Okay, thank you so much.
Of course, it's nice to see you all. We do these the first week of every month. If you enjoy it, if you learn something, pass it along. We really love to be involved in the community and be available as a resource. That's really why we do this, is people have questions about their health and don't always have access to a physician. So this is people's chances to be able to get in with those questions. So
I do have a question.
Thank you.
yep. Anybody who wants to hang out for a second to ask some quick questions, I'll stay here for a few more minutes. Otherwise, that's essentially the gist of it.
I had a question just about the probiotic effect and having fermented foods instead. So is apple cider vinegar, just as a diluted drink, something where you can put that fermentation process going before a meal or first thing in the day or throughout the day?
Leah, I am having a little bit of background noise there. Just repeat that last part of the question. Sorry.
I'm sorry, my sound is really bad. I was asking if apple cider vinegar helps that natural fermentation digestion process that you were talking about, like with sauerkraut and pickles. Can you just do the red apple cider vinegar?
Yeah, so the health benefits of apple cider vinegar when it comes to the GI system, for what I use it for, is delayed gastric emptying. So how it's beneficial isn't so much of actually increasing fermentation, but more keeping food in the stomach longer. So if we do have low hydrochloric acid, or we're slow to the jump to break down food before it gets passed along, is that we'll hold it in there a little bit longer so it can do its job to fullness and then pass that digested food down to the small intestine. So we're not getting these larger chunks that are undigested into the small intestine, say, hey, absorb this. And it's like, I don't even recognize this because you didn't do your job. So my primary use for apple cider vinegar is actually people with type 2 diabetes who have some atonic bowels or some gastroparesis. I've used it in some people with Parkinson's as well who have, slow or sluggish motility, and that make sure that your food is fully digested before it passes on to the next phase.
Okay.
The other thing about apple cider vinegar that I'd be remiss if I didn't mention is that it's very caustic to your tooth enamel. So if you are going to use it, first of all, I always say consult a health professional for like, hey, is this right for me? Not everything is right for everybody at a prescription level, right? If you're going to use it daily or something like that, how is that going to affect your health? But broadly, it is very caustic to your tooth enamel. So I always say either drink it from a straw and or swish your mouth with water after you swallow it, because we don't want to wear down that tooth enamel.
Okay, great. Thank you.
Sparrow, question. Sorry, I'm going to answer this chat question here really quick, Matt, and then I'll come back to you. The fermented foods lowering hydrochloric acid. I honestly don't know the answer to that question, so I will look it up. And if you want to shoot me an email to our clinic web email, it's info@CDA Healing Arts, or call the clinic and just say, hey, I asked this question, and I can make sure that I have that ready for you. But does fermented foods lower hydrochloric acid ability? My gut reaction is no. I mean, pun intended, that fermented foods wouldn't inhibit your ability to make hydrochloric acid. Okay, Matt, did you have a question?
Sure. Is there a book that describes some of the ideas you're sharing that would be helpful to read?
Oh man, yes. There are many books that talk about, you know, the vagus nerve dysfunction and the gut-brain connection and different things like that. I'm trying to think of the polyvagal theory is one of my favorites. And it essentially, in my opinion, is the kind of wraps it all in a nice little package of what the polyvagal theory is and how our parasympathetic nervous system and sympathetic nervous system are balanced through that vagus nerve and vagal nerve dysfunction. And I think what I took from that then was being able to go to just about every system in the body based on that theory and apply that in a way that's really effective for how our physiology functions optimally based on that balance between the two nervous systems. Now, specifically gut-brain axis books, I mean, I can't even begin to say how many are out there. I can't say I have a specific one I'd recommend. But again, if you want to contact the clinic, I can always make sure to get back to you with something that I find.
Thank you.
Yeah, absolutely.
In some recent reading I have done about type 1 diabetes, I've learned that you can measure the damage to the vagus nerve by measuring the heart rate difference between when you're breathing out and when you're breathing in.
Mm-hmm.
I thought that was a very interesting way to diagnose vagus nerve damage.
Yeah, and that's essentially, I think you may have come on after we talked about this, but that vagus nerve really it controls your ability to jump back and forth between the sympathetic and parasympathetic nervous system. And in doing that, we get what's called heart rate variability. And heart rate variability, to me, in the simplest form possible, is resilience. We want our heart rate to be variable. We want every inhale for it to go up a little bit and we go into sympathetic nervous system. Every exhale, we actually stimulate that vagus nerve and we go into parasympathetic passively. And that's what this, but Stephen Porges just came to me. That's the author, Dr. Stephen Porges, talks about this, is that passively we are on a teeter-totter 24/7. We're going to sympathetic, parasympathetic, sympathetic, fight or flight, rest and digest with every exhale and inhale we take. Now, what happens in stress and life, and you think about it, 7th grade math class, you know, they put you on the spot and they ask you a question. What do? You go, right? And boom, right away, that sympathetic nervous system without the exhale. So there's a lot of different things that you can do to exercise that. My first nervous system hijack is the 4-7-8 breathing that Andrew Weil created, because we're literally hijacking the system by making our exhale twice as long as our inhale, saying, hey, nervous system, chill out. We are safe. Now, outside of that, therapeutically, I practice biofeedback. And how do we measure heart rate variability? And can we see, are we at this steady state all the time, which makes us very fragile and vulnerable, or are we flexing back and forth every time, which makes us very resilient and adaptable to our environment? So that's a great point to bring up, and I can talk about that subject all day long. So I appreciate that.
Thanks. It's helpful for me to hear you say that and understand what the physiologic basis for that measurement is, how it functions.
Oh, great. All right. Well, I do have to, last question here. Can heart palpitations be caused by vagus nerve dysfunction? Yes. Yes, they can. PVCs is one of the most common conditions that I see in my clinic, and we do some vagal nerve work, and then I don't see people again. So it's a lot of, now I'm not saying it's the root cause of all dysfunction or issues, but it is a huge contributing factor, I would say, to all of them. Even if we have a disease, how we respond or how we relate to that disease or that diagnosis is strongly reliant on our nervous system's adaptability and resilience. So to answer your question, Yes,
Thank you.
participates. Yeah. All right, everyone, I have to sign off here. It's been a pleasure to see and chat with you all. Feel free to reach out. Like I said, contact the clinic if you have questions, comments, concerns about today's Zoom. And like I mentioned before, it'll be up on the social media. And if you can share it with somebody you think you'd like it, we'd appreciate it. This is a community outreach program to help shift the health of our local and global communities. Take care.
Thank you.
Of course.